Good evening. Good evening, everyone. Wow. He's like, let's get going. Welcome to our annual public meeting. This is our first public meeting since the pandemic, and it's so good to see all you here, and it's also nice to see some familiar faces from the past, so I appreciate everyone being here. We also are streaming live, so for those of you who can't be with us in person, I'd like to welcome those of you who are joining us by online. And I also want to thank a couple of my health center colleagues here, Chuck Jones from Harbor Health and Michelle Nadeau from Dorchester House. Thank you both for being here. I am your host for the evening, and I'm joined by Bobby McEachran, our chairman of the board, who will also be co-hosting the event with me tonight. But before I tell you a little bit about Bobby, there are other board members here, so if you are on the Codman board, please stand and be recognized. So a little bit about my co-host who's up here with me. So community health center boards are made up of community members, patients, and experts, and Bobby happens to be all three. Bobby's roots in the community are deeper than many of us. He's a fourth-generation Codman Square resident, and he continues to forge new ties with people. I know someone said, wow. Bobby keeps his ears to the ground for community needs, pays close attention to the healthcare trends, understands our industries, and steps up to help. And for those of you who recognize Bobby, he does daily walks around the health center. And sometimes he does walks inside, but he's always walking the health center. So, and he's been on our board for 20 years and as our current board chair. So please join me in welcoming our own Bobby McEachran.
Thank you. Ooh, a real live mic. I'll step back a bit. I want to take a moment and thank everyone who's here today. I would like to thank Sandra specifically, but we're going to honor her in a few moments. I'd like to also thank the people who are not able to be here today. I want to give a special shout out to our board member emeritus, Emmett Farzo. Also, one of our co-founders, Charlie O'Hara. He's watching online. And I want to give a shout out to Charlie since we're in the house that he helped build. And one slight correction, I'm actually a third generation Codman Square resident. My dog is the fourth. But my journey of community activism started when I was a teenager. I got sick and tired of drug dealers using my street for a drop, so one day I took their stash. Didn't really think it out too well. But that began my journey to where I am today. Over the years, the one thing that's been always consistent about the neighbors and the residents of this community is the ability to step up, work together, and create meaningful and lasting change. And this health center is kind of emblematic of that. Years before, just before I was born, Charlie O'Hara and Bill Walzak were sitting on a floor in Charlie's house, probably in like 73 or 74, and started thinking about a journey that they were just about to start to take together, where they started talking about creating a community health center, when at the time, not many people were thinking about creating or doing new things in Codman Square. Growing up, as I said, being a third generation here, a lot of my early memories in the neighborhood had to do with the smell of smoke. There was almost a daily fire in the community of people torching houses. There was a massive exodus from people who owned houses and people who had rented because of the violence that had taken over the community. A lot of people pulled out and left. For those of us who stayed, I'm a proud graduate of the Boston Schools with a learning disability. For those of us who stayed, the identity that we created of being proud of where we lived was important. Oftentimes, people would say to us we should be ashamed or look down on our community, that they had highlight our challenges instead of seeing the strengths. Throughout over 40 years now since the health center has started, it's talked about not just the story of Codman Square, but given an opportunity for community residents for employment, giving the opportunity for community residents to have equal access to competent, culturally sensitive health care in the community, that the organization that we stand in today is truly a community organization. All too often, a lot of nonprofits, when you get larger and larger, there becomes a fundamental disconnect between mission and purpose, between the individuals receiving care in the health center and those providing care in the health center. Codman has been on a cutting edge of figuring out ways in which to grow our own, as our co-founder Bill Walzek has said many times, through programs of training, education, and opportunity for people in this community to get jobs and stay in this community. And every annual meeting, it's important for sake a few moments to remember how that happened. It happened because at some point people said enough's enough. We're in it together and we're going to make this work. Every day, the staff of Codman Square show up and make it work. We haven't had an annual meeting since 2019. I personally always like annual meetings because it gives us an opportunity to literally and figuratively fly our flag. When you came in the front door, there's a Codman Square Health Center flag blowing in the wind. Part of that to show the pride that we take and to mark our little patch here in the community. But over the past 4 years have been very challenging and difficult for everyone. I was actually president. This is my 20th year on the board and my 4th term as president. I was president of the health center when COVID hit. And it was a very challenging time for everyone. It was a very scary time. And it's okay for us to say that. It's still a very scary time for a lot of people, and we need to remember that. But in scary times and challenges, it's very important to look for those things that are consistent. I spent 25 years working with at-risk teens, and one of the little lines I've said 100 times, and they say I say it too much, is I say, take some lessons from early in life. A lot of us grew up watching PBS, and Mr. Rogers used to say, always look for the helpers when there was a problem. During those early COVID times, people looked to the health center because they knew us. They trusted us. And during those scary times, every day I walked by, and every day our staff parking lot was full. Leading up, I remember Easter weekend, I walked by when things were really getting bad. And I was crying so hard because I just saw all of our staff leaving their families, taking great risks to provide care. That was the moment that really reminded me the strength of Codman. That through all the challenges, people still showed up. That didn't happen in a lot of other organizations, and that speaks volumes to the team. And I want to be very clear, Codman is a team. The only reason why we exist and we're able to deliver such a high quality of care is because we are a team. From facilities up to everyone in the chief's suite, everyone needs to be treated equally, everyone pulls their weight, and everyone contributes to the way in which Codman cares for the patients. And that is a testament. So I just want to take a moment and get a round of applause for everyone on Team Codman. And over the past few years, there's a lot of accomplishments listed. And for those of you who've been in meetings with me before, there's no reason to read slides. We can get through this quicker. So please read the annual report, and you'll see the highlights. But I just want to take a few moments to tell you where we're going. After 40 years, a lot of organizations can rest on what they've done and feel comfortable. And honestly, as many of us know, we're entering a time of transition. And during times of transition, oftentimes people feel the need to take a step back, maybe do less, create less waves, and kind of stay in the background. Well, clearly that's not the way Codman does things. While in the coming year there's going to be some challenges and changes, I want to be very clear. The mission of Codman will not change. The way we do things will not change. Our leadership is going to change, but our core mission will not change. And I want to keep reiterating that because people need to hear that sometimes during change. What we're committed to in the years coming ahead is to go deeper and broader than we have before. We're really the close end of a very fundamental strategic planning process, where we've taken an opportunity to have some very hard conversations. And I appreciate the team Codman for every member of the team, the hundreds of responses, in-depth answers to questions, that is informing and tuning the search for the new CEO, reminding and grounding the board on our mission, and ensuring that what we do, we continue to do right. At Codman, we have a saying, if we're going to do it, we're going to do it the Codman way. The Codman way is also many times thinking out of the box and making sure that we continue to deliver for excellence to all in the community. We also do another thing that's coming up next week. We like to celebrate and party. Oftentimes, a lot of organizations look at things in a very clinical way. The good thing about Codman is we're a true team. And next Thursday night, you'll see me in my kilt, and we're going to have a really good time. Because being together is where it's at. Part of the good things about Team Codman, we all like each other. We all like my sense of humor. And we're all committed to Codman. So without any further ado, I'm going to turn this back over to Sandra, and she's going to introduce Kate. Thank you very much.
Well, Bobby, that was a tough act to follow. I am very pleased to introduce my friend and your Secretary of Health and Human Services, Kate Walsh. So Kate and I have worked closely when she was the CEO of BMC, where I serve on the board. At BMC, Kate led 514-bed hospital with a long history of community-based care. She's always been a key supporter of community health centers. She had a staff of 5,000 employees, 1,300 physicians, with an annual budget of $1.5 billion. I'd sit there and I'm like, wow. Most of our patients get their specialty care at BMC when we're not able to provide the services for them at the health center. When Governor Healy reached out to Kate to be our next Secretary of Health and Human Services, I was excited for the Commonwealth and its residents. And I could not think of anyone more deserving and prepared to take on all that this position entails and succeed other than Kate. Now Kate has a larger team. She has 21,000 staff across 11 agencies in the Mass Health system who work daily to provide services and programs for nearly 1 in every 3 Massachusetts residents. That's impressive. The health of a Commonwealth is in better hands because of her experience and leadership. On a personal note, Kate and I have worked together for over 13 years. When I stepped into the CEO role, Kate asked me to serve on the BMC board. One board became multiple boards and multiple committees, and I spent just as much time at BMC as I did at Codman. She's become an amazing colleague and a dear friend, and I'm so happy to introduce Secretary Kate Walsh as an honoree of this year's public meeting. And we will honor Kate with a Mango Man picture. So for some of you who don't know, this represents Codman and our community, and all of our awardees get this. And so no one is more deserving than Kate, so I'd like to welcome Kate.
Thank you, Bobby and Sandra, and to the Codman board as well. I'm really just so grateful to be here tonight and really honored by this award. I'm told that the Mango Man recognizes people committed to community health or improving health on a community level. And truth be told, I fly a desk. So this really is a true honor, and I'm very humbled to receive this award. And even more delighted to be receiving it alongside my good friend Sandra Cotterell. Codman Square Health Center, you guys know this, is a magnificent organization that has served this community for decades. As you heard, I spent 13 years of my career at Boston Medical Center, where I was fortunate to work with a number of great health centers, some of whom are in the room today. In and around Boston, Codman was included in that, and BMC was privileged to share the care of Codman's patients. We were a better hospital because of this health center's expertise, understanding, and commitment to their community. Codman and its fellow CHCs deliver care that's not only high quality, but it's expert, it's culturally relevant, it's compassionate. You take on a huge portion of care for the uninsured and new arrivals to our country, and you are central to our work on equity across Massachusetts, across the city of Boston, across the world in some cases. Access to high quality, culturally competent care is sometimes difficult to find, but here at Codman, you treat every patient with a welcoming hand and great care. This care has been in really very capable hands of my good friend Sandra Cotterell for many years now. As an industry leader for over 3 decades, Sandra's took the revolutionary idea that Bill Walzak and other community leaders started in the 1970s and turned it to the national model that community health centers are today. Sandra started her career as a nurse, and she never lost her focus on patients. You know, when I was at BMC, she would call me in her very calm and quiet way sometimes and say, "Kate, we can do better." And under her watchful eye, Codman has expanded even further to provide community resources. And Codman's influence on health policy across our city and across our state has only grown under Sandra's leadership. Because she was always willing to try something. She never said no, witness all the boards she serves on. She led the early days of and still leads the Boston Accountable Care Organization. But what I admire so much about Sandra is she took on this job when it was unproven and really unpopular. She would partner, I think, with anybody to make people to get people healthy and keep them well. And I think she said, you guys know better than me, these partnerships include the Codman Academy Charter Public School, the Daily Table Grocery Store, HealthWorks Community Fitness, and so many more. That's a sign of a true community center. I always say that Sandra makes it look easy. She's always like perfectly well dressed. She's, always calm. She's always prepared. I kind of envy her for that. She gets to the gym, which I've forgiven her for. But I think it's because she comes to her commitment to community naturally. She's a lifelong Boston resident, and her ties are deep and wide. Whether she's leading a group of new women runners, which, by the way, you never asked me to join, or her work with the 261 Fearless organization, or leading Pop Warner football. I mean, Sandra shows up. I remember in the early days of COVID hearing stories from her running into friends and people in the community who needed COVID testing, right in this building, right? And down the street. And folks knew that Sandra was the person to see not only if you needed important medical care, but just a source of trusted advice during a difficult time. And I can remember so many times in my career where I had difficult times and I got trusted advice from Sandra. And throughout all those excruciating COVID experiences that Bobby referenced, Sandra made sure that this health center didn't miss a beat. While the rest of the world were closing their doors and putting on their masks and making bread, Codman was heading out into the community. She truly led a frontline organization and faced the unknowns of the pandemic just fearlessly. This team and people in this room don't need to know about the statistics about how hard COVID hit this community and hit communities of color across Boston and around the state. But when you guys needed Codman more than ever, this team was here. In its 44-year history, Codman's only had 2 CEOs. I don't know many organizations that can say that. I think it shows you, yeah. I think it goes to show you the kind of commitment that Codman engenders and the strength of this community and its board. And I think Bobby used the term pride. You guys should be enormously proud of your accomplishments. Sandra, I wish you the best on, I won't say on your transition. When you get to a certain age, you don't say retirement. It is really so well deserved, this transition or next phase, after a life of commitment to others. You have so much energy, I can't imagine you being retired. But I also know that the health center and this community will be in good hands, not only because of all of the work that you and your team have done to set this organization up for success, but because you've embedded yourself in this community and you surrounded yourself with leaders and board members and staff who really care and are ready to do whatever it takes to take care of people. You're ready for whatever this world throws at you. That's the Sandra Cotterell way, and that's the Team Codman way. Thank you so much for this award. I'm very honored.
You can join my run club anytime. Okay.
This is beautiful. Thank you.
Tony? So it's very hard to summarize Sandra in a few words, but I'm going to clue everyone in the room a few words that Sandra uses a lot towards us. Let me noodle on it for a minute, and let me check my nursing math. Over the years, I mentioned that Codman likes to party. We also do surprises really well. I like the uh-oh. She gets this. To say that Sandra has been a great partner and a leader is an understatement. Sandra oftentimes models exactly what she wants staff to do. I can go on forever about that, but I won't. As board chair in February, when we started discussing that Sandra planned on retiring, I can't repeat some of my initial words appropriately in public. I might have asked for maybe just 1.5 more years, so selfishly I wouldn't be board president. But as we started thinking about it and talking about it, we really had a lot of in-depth discussions about what Codman means and what Codman has meant to Sandra. It's very hard for us on the other end, staff, patients, and community members, to tell someone exactly how much they mean to you. All too often, we only tell that after the fact and someone's not in the room. But this time, we get the chance to tell Sandra how much we care about her, how much we appreciate her, and how much she's been a legend for everyone. So it gives me a great honor to report out. I don't think I need a mic. So it's a great honor to summarize and report out on the June 25th board meeting of the Codman Square Health Center in the executive session. I put forth a resolution that was unanimously accepted by the board as a very, very small tribute to Sandra and her great work here at the health center. Going forth, actually, from this point forward, our facility at 450 Washington Street will hereby be called the Sandra Cotterell RN Wellness and Fitness Center at 450 Washington Street. And this is not just to highlight her many years of service in past tense, but highlighting her many years of service going forward. Sandra has committed to spending her retirement still working in the community, leading runs and health and wellness fitness programs for the community. We thank you beyond very much. See, we pulled off a surprise. After 40 years, it never gets old. Thank you.
You did pull off that surprise. That is absolutely amazing. And for those of you who know me, as Kate said, you know, I do believe in health and wellness and fitness. I feel like, you know, I need to walk the walk and talk the talk for our community. And it's always kept me at a good place so that I could be at a good place for all of you and all of Codman. You can't take care of a community if you can't take care of yourself. And so this has always been part of me taking care of me. So first of all, I'd like to thank Bobby for, one, your kind words, Kate for her kind words and reflections. I also want to call out Bill Walzak, who hired me over 30 years ago. Took him forever to make that decision. Some people thought it was because I was a tough negotiator, but it was more of Bill taking time to really vet me as a candidate before he welcomed me into the community. And I'll never forget, during my interviewing process, jumping in his car and riding around the streets of Dorchester at some reasonably fast speeds as he's interviewing me, and I'm just getting out of corporate in the hospital. I'm like, is this for real? Is this what goes on in the community health center world? I'd also like to thank the board of directors who 13 years ago gave me an opportunity to lead such an amazing organization, so thank you. A lot has happened in 29 years, but none of it would be possible without Team Codman. And those of you who know me, that's what I call you. I'm a sports junkie, I'm a football junkie, and you've always been my team, and I could not have done the work that I do without you. Each and every staff contribute to the success of this organization, and my job has been made so much easier because of your commitment and your dedication to this health center, our patients, and our community. Dorchester has been my work community for nearly 30 years. Bill would often tell me I spend more time here than I do in Mission Hill, but it has also been part of my fitness community, and I have had the pleasure of really working out of our 450 Wellness Center, where I coach a group of women in Dorchester and the surrounding neighborhood, and that's been part of my journey, and that's work that, as I transition, that I will continue to do. As part of my succession, I will remain at the helm until a new CEO is appointed, and I look forward to supporting that person through their transition as they take on this amazing organization. Codman's been a great place to work. It's been the longest place I've worked, and I look forward to really looking at what happens next for this amazing organization. And it's going to be a good place because all of you will still be here to carry on that torch and that work. And for me, it's just so nice to look out and see all of you and your dedication. So thank you for this recognition, and thank you for this tribute. So thank you guys so much. This is, at some point we'll take a pic, but I do want to just highlight a few of the accomplishments as we look back to 2022. Codman has served over 24,000 people. We have provided over 110,000 visits. 74% of our visits are medical. The other visits are our specialty services like dental, behavioral health, eye, and enabling services. We continue to vaccinate against COVID and the flu. We were happy to re-engage with our community, participating in the Dorchester Day Parade Walk, the Mother's Day Walk for Peace. We hosted our annual block party on social Saturdays. We did the Making Strides Against Breast Cancer Walk, and I will continue. Christine has my number. She'll be texting me, "We're walking. Are you going to be there?" I will be there. We hosted officials. We had United States Secretary Health and Human Services Becerra and U.S. Representative Presley host a roundtable with some of our providers and community members on Black maternal health. Senator Markey also visited us to champion the importance of health centers. We hosted several virtual nights in partnership with Union Capital, talking about everything from COVID, climate change, racial stress, health equity. We continue to be a leader in HIV and hosting a World AIDS event. Our care teams engaged with our patients around hypertension and diabetes care and brought them back into a system of care. Our tax clinic provided $2 million in our community at no cost. For the first time in the history of the health center, we are expanding to the town of Randolph. And right now, that's right, that deserves a round of applause. And right now, we're underway to launch that clinic and supporting both the students and that community. And our team right now is also working to provide, even though we don't have brick and mortar, we find creative ways to make things happen. We're providing behavioral health services. We provided sports physicals. We're vaccinating that community. We're staying connected to them until the brick and mortar is there. We celebrated our 25th Men of Boston, and on next Thursday night, we'll be looking at 26. And these are just a few of the things that Team Codman has done. And there's a lot of Team Codman in the room. So if you are part of Team Codman, current or even in the past, please stand and be recognized. All right. I know that we have to do the ceremony of handing me the Mango Man and taking pictures, but I just want to thank you all for being here tonight. Please come next Thursday night and party with us under the tent. That will also be a great time. There's plenty of food in the back. There's cake in the back. So enjoy the rest of your evening. And again, thanks so much for being here. Do you want to do the